Hi, this is Nairobi with Clinical Motivation, which is an HHA enhancement program. I got a really good question from a home care business owner. And the question was, I provide non medical home care services. How does value based care affect my agency? Well, for those who are in the home care industry, you guys all know that we are transitioning into value based care, meaning those agencies who are providing more value, whose quality indicators are higher, will be getting more reimbursements, more quality incentives, which translates into more funding, more money. The question is, how can you thrive in the middle of all of these changes? So, number one, the first tip that I would want to share with you is, are you measuring the quality outcomes? You should be measuring exactly what the MLTCs are measuring. So, there should be either a department or somebody that is measuring these outcomes for your patients. And the outcomes, what are these quality indicators that drive outcomes? It Flu shot, preventative care, monthly follow up, or follow up medical follow up with a doctor, um, whether this patient has been rehospitalized within the last 60 days of a previous admission, whether this patient is medically compliant, whether this patient is lonely or depressed. These are all quality indicators that have already proven that once they're high, it means that there is a higher level of quality that is being provided. There's a reduction in hospitalization when the patient is compliant. But I don't want to get into that depth. All I want to tell you for this video is that you should be measuring your indicators. You should be measuring exactly what your MLTCs are measuring. And once you're measuring these things, you're able to elaborate a plan of action in terms of how you will get your caregivers to deliver higher quality of care. If you have any questions and you are seeking to improve your caregivers, this is what the Clinical Motivation Program is about, and I would love to hear from you. Do you have any questions? What do you think about value based care? Do you have any concerns? Feel free to reach out to us at info@clinicalmotivation.com. I would love to hear your comments. Again, I always like to say that the level of care and the quality and the value of care that you provide by your patient is reflected by the caregivers that provide the service. You cannot say you have outstanding quality if your caregivers are unable to set up a medical appointment for their patients, if your caregivers are struggling to write their names, if your caregivers are struggling to do the most basic things that they should be able to do. So if you're going through that situation and you need an extra push, you need extra support for your caregivers, this is what clinical motivation is about. Looking forward to hearing from you. Bye bye.